As a sexual health educator, I get asked a lot of questions, and I wanted to answer one of the questions that I get the most, which is, can you get an STI from oral sex? And the answer is yes. As a person who talks about sexual health all day from my job, I really do think that oral sex gets left out of a lot of conversations about safe sex. A lot of people talk about wearing a condom, which is relevant to oral sex, but not a lot of people talk about dental dams. A lot of people talk about getting STIs when they're having sex with their genitals, but nobody's talking about STIs from eating someone out or giving someone a blowjob. Oftentimes, when people talk about getting tested, they don't think about getting tested with their throat and doing a throat swab. So today we're going to be debunking the myth that you can't get STIs from oral sex or that it's not very common. We're going to be talking about the kinds of STIs you actually can get, and we're going to be talking about how to make oral sex a little bit safer. Hi, I'm Taylor. I'm a sexual and reproductive health nerd, and I love to talk about ways to make sexual health a little bit more pleasurable. So, can you get an STI from oral sex? Yes, you can. If you're having sex with someone who has an infection in their genitals, their anus, or their throat, it is possible for that to be transmitted to you. And depending on the infection and what kind of sex you're having, aka where you're putting your body parts, it is possible for you to get this transmitted to your throat, your genitals, or your anus. While the risk for getting STIs through oral sex is a little bit lower than other kinds of sex, it is still a risk, and it is still something important to keep in mind. Lower doesn't mean zero. So gonorrhea can be transmitted to the throat. Now, here's the tricky thing. As with a lot of the ones that we're going to be talking about, you will not always get symptoms. Maybe you would feel a sore throat or something along that lines, but you can actually go about your life without really seeing a lot of noticeable symptoms, which, as you'll see throughout this video, it is really important to just test whether or not you have symptoms. Chlamydia of the throat is possible. It's a little less common than the transmission of chlamydia through genital to genital contact. However, the risk is not zero. This is another tricky one because you may not have symptoms. Syphilis, and again, this is another one where you may not realize that you have it. So you can certainly transmit or be transmitted syphilis through a syphilis sore, but sometimes these aren't always obvious. So another one is herpes. This is another one that could be transmitted through the mouth. I think it's a little bit more common for people to know this, but yeah. HPV. HPV can also be transmitted through oral sex, and this is why it's really important to look into the HPV vaccine. HPV infections can often clear up on their own, but in the cases where they don't, this can actually have a lot of really, really negative effects on your health, including risks of cancer. Because I work in HIV services and I do STI testing with folks, one of the big common questions that I get is, can you actually transmit HIV through oral sex? And I think it's a good question. In my research, yes, you can transmit HIV through oral sex. However, the risk factor for this is a lot lower than other kinds of sex. Because there is a lot of stigma and also a lot of misinformation and fear around HIV for a number of different reasons, I did want to just throw in there, U equals U. So undetectable equals untransmissible. If somebody's viral load of HIV is undetectable, it is not able to be transmitted through any kind of sex. If the person's viral load is undetectable, there would be a zero risk. However, without any kind of barrier or protection, you could also transmit other kinds of STIs. And what if you're a queer woman? What if you're a woman who has sex with women? Yes, queer women can get STIs too, and as a queer woman, I know that these conversations are not often talked about. I think that it's really important to note this, and we really can't blame a lot of people because oftentimes sexual health education is extremely heteronormative and doesn't really include queer folks. So one of the things that you can use is condoms. I know that when I was growing up and I was in high school and like early university years, I don't even think I remember hearing anybody talking about using a condom during oral sex, which now as an adult and especially as someone who works in sexual health, it's like shocking to me. But that being said, if this isn't part of the education you were taught, if this isn't something that was normalized in conversations around you, no judgment. It's never too late to start, and it's never too late to start advocating for this. Flavored condoms make it a lot easier. Non-flavored condoms don't taste very good. And another thing that you could do is if you don't have a flavored condom, you could use a regular condom and then use a flavored lube on top of that. I wouldn't recommend getting experimental with other kinds of oils or anything like that because oftentimes different oils can actually break down the condom and then the condom isn't as effective. So just stick with a flavored lube. So for oral sex on a vulva or an anus, there is something called dental dams that you can use. And this is what one looks like. I'm gonna show you what they look like. And you can get these at many sex stores in areas where there are condoms being sold, and you can usually get them for free at sexual health clinics or nonprofits, anything like that. So as you can see, it's just a very thin layer of latex, and essentially you can put this over where you need a barrier and you are able to perform oral sex, and a lot of the sensation is still there. Dental dams are really great if you want that flavor. Again, feel free to experiment with flavored lubes, which could make it a little bit more fun. And the other part is if you do not have dental dams or you don't have access to it, you can actually make a dental dam, a little makeshift one, by cutting a condom, and you could actually just stretch it out and put it over the area where you're going to be performing oral sex, and this will work very similarly. Do you need to use barriers every time that you have sex? And the answer is it really depends. I am not for shamey, judgmental sexual health education. In reality, life happens and we all have different decisions that we make that work for us. And if you make a choice that works for you and your partner, that's great. You're never going to get to zero risk of transmission of any STI. And I'll get to this in a bit, but as long as you keep yourself safe, maybe you use condoms with new partners, maybe you are getting tested regularly and so you feel comfortable without wearing condoms, maybe you have an active flare-up or your partner does, so you wear condoms during that point. It really depends on your situation and what you're comfortable with. Of course, get tested. It doesn't hurt. It's really not embarrassing. It really should just be a regular part of healthcare for people. As a person who helps people do STI tests, STBBI, which is bloodborne infections as well, it's super easy. You can oftentimes in many places get at-home kits, so you can just do a swab. In the case of oral sex, you can do the throat swab, but yeah, super easy. You can usually just mail it off to them and get your results back. One of the things I wanted to make sure that I said in this video was STIs are not a death sentence. Even with STIs that have historically been, we've come a long way. And this is not to minimize the impact that they could have on somebody, but it is to say, don't be scared to go and get tested, and don't be scared to get treated. While it's really important to understand the risks and understand transmission of STIs, it's not a death sentence, it's nothing to be scared of, and it's something that we should talk about more often. They're not dirty, it doesn't mean that you're clean if you don't have one. They're just a part of life, and they're really, really common. So yeah, if you are watching this video because you've recently been told that you had some kind of contact with an STI, or maybe you're interested in having sex with a partner who has an STI, hopefully you're able to feel a little bit more comfortable about making a decision that works best for you. If you learned something from this video, or if there's something that I missed that you think would be interesting or useful for other people, feel free to add it into the comments below, because as I always say, I want this to be an educational space for people to chat about things that we don't always get to chat about outside of these spaces. And if there's a sexual health question that you've always been embarrassed to ask, or maybe you've just Googled, feel free to write it in the comments below, and maybe I will select that to make a video out of. Have a wonderful day.